All right. Okay. Good evening, everybody. So we have
Good
a few
evening.
participants, and we have Prof. Mohammad, and it's me, your host for again for our. We had a 1 week break for Chinese New Year, so it's still
Yeah.
it's 10 day of Chinese New Year. So Chinese New Year, by the way, it's 15 days of celebration. So if
Mm-hmm.
you've heard the you've heard about the fireworks and the yesterday. It's actually no, today's actually the 9 day. Sorry, yesterday was 8 day, and basically it's a Hokkien New Year. So the Hokkiens will have a special prayer. So hence why there's a lot
Okay.
of firecrackers and fireworks. So it tends to be a bit loud, and but yeah, that's to ring in the new year as well. So every day there's a different and on a 7 day is everybody's birthday. So
Oh,
that's how that's a bit of a symbol, a bit of culture there. So yeah, so that's Chinese New Year for you. So I
thank
hope
you.
everybody has been well. Great. So again, on this week of Ask the Experts, we have again our usual crowd. Welcome everybody once again. So I'm Felicia. So we have this weekly Ask the Experts session, and we speak about different various topics to keep each other company. I think to also entertain ourselves, but by adding on more knowledge and understanding. And this week's
Mhm.
topic is also equally interesting. I think we had our last session was about are you getting angry, during
Angry.
COVID-19? Yeah, how do we manage? So today or this week, we are going to learn how to understand and manage your emotions during COVID-19 pandemic. Yeah, so stress is one thing, being angry is one thing. All these are emotions, right? So it is
Mhm.
valid. We just had a topic called "It's okay not to be okay." So now
Mhm.
we are learning how to understand it a little bit more and how to manage them. So, or is yours, Prof?
Okay, thank you, Felicia. Just let me share my slide to start with. So, right, basically, I choose this topic. It is a continuation of the previous session that we had. So, it's very important to actually exercise how to actually look into our anger, our frustration. Those are our emotions. So once again, as I said, you have to know how to control your emotion, or then all the emotions or whatever emotion that you have will control you. So that is very important phenomena here, because we don't want ourselves to get down into the more difficult situation because of our emotion that we actually go around with what we had. Usually the negative emotion, that is the issue that is important for us to take note. So that was my first slide. Let me just make it big for you all. Okay, so that is what it is all about now. Try to manage your emotion, but before that, you must understand what emotion is all about. So this is the key. Control your mind and master your feeling, and then you'll be able to actually manage your emotion. So what goes on in your feeling will be translated into your emotion. So this will include thinking, overthinking, exaggerating, over exaggerating, inclusive, over inclusive, and whatnot that actually triggers this kind of situation. So if we were to know for this lockdown, the COVID-19 lockdown, they have done a study. So only 28% actually indicate that they have positive emotions, and 3% actually have really negative emotion, but about 69% actually experiencing mixed emotion. So this is where we can see some people after a long while into this lockdown. So with a mixed emotion and with a negative emotion, so they will end up actually having more and more trouble with regard to their self, with regard to the people around them, and with regard to actually their so-called late day living and life and livings. So these are the possible expression of your emotion. That you can feel, shock, you can feel confused, or you can show confusion. You can show anger, you can show, you're in awe with the situation. So these are the various expressions that you can take note. But most important is you must know that whenever there is a perceived threat, so usually stress make us think that there was a threat. There is someone who doesn't see the stress or the stimulus that cause us to feel the so-called the burden or feel the pressure, and subsequently we feel that our body is responding to it in more situation of a stress. Then we actually at the end of the day believe that it is threatening our ego self, it's threatening our so-called physical sense, it's threatening our emotional and psychological sense. Usually, with a perceived threat, you can respond either with sadness or depression, with anxiety or with anger and hostility. Actually, possibly there is a number of us that could actually doesn't feel the threat at all, and it is a challenge to them. And in fact, they actually thrive in terms of stress, and that's this group that can feel the joy of actually experiencing this so-called stress. So for those who actually end up with sadness, anxiety, anger, and whatnot, so obviously it will take a toll on their self with time. And unfortunately for COVID-19, the issue is getting into what we call chronic stress, and it is appear to be more and more with time, more and more threat, more and more situation that we feel that it is becoming more and more contagious, it's becoming more and more virulent or more and more deadly. It can cause a lot of trouble and whatnot. So that's why this become a chronic stress to all of us and most of us. So here I just want you to understand what is emotion or and feelings. So there's these two diagrams that can tell you what they are. So usually emotion is what the physical state that arise from a response to a particular stimuli, and feelings are actually the mental association and the reaction to the emotion. So emotion is what we call express, feeling is what is within ourselves. So usually feeling will come after the emotion, but before the feeling comes aroused, then we have the emotion aroused before the feeling. So usually it is a physical state for emotion, but for the feeling, it is a mental association and reaction. So we can see, we can observe through the physical reaction in emotion, but the feeling can be hidden. So we don't know somebody's feeling until unless they express in terms of emotion. So feeling is what is inside us, emotion is what is being expressed outside us. So there's another way of looking at it. Example, emotion tell us what we like and what we don't like, and feeling tell us how to live with what we like or what we don't like. Or emotion state the external world matters, but feeling is your own emotion that is matters, the inner feeling. Or emotions are intense but temporary, but feelings are low key and usually is more and more prolonged. Emotion usually establish your attitude towards the reality, but feeling establish your long-term attitude toward the reality. So emotion is much more rather a short term, but feelings can go in a very sustainable long period of time. So these two is very important because some of us maybe thought that feeling and emotion is about same. So there is a difference. It's about like the climate and the weather. You know, weather is today, but the climate is the more prominent one over time. So here we talk about mental and emotional. There's another issue. A lot of I want to suggest you to understand this terminology because a lot of people are worried about when they say mental. Their attitude toward mental, the myth that is always there, it is a taboo word. People are thinking when say that it's mental, it is something already become serious. It's already damage things of that nature, and that's because of this taboo and stigma. That's why the word mental is not being used or actually being avoided by a lot of people. So, but mental behavior is actually related to your mind, but emotional behavior almost always deal with your heart feeling. A mental affected person may prefer to be a mentally affected person, may prefer to be cool, calm and quiet, but an emotional person actually show it out with sounds, with behavior. And a person affected by a mental transformation will often appear unhealthy or abnormal. That's why we can see a change in person if they has a mental. And usually the change in the person is shown either in their so-called behavior. Usually behavior is a telltale sign of something is going on already with a particular person. And then the feeling is something that you don't really know, but it's been shown in the person's demeanor kind of a thing. So an emotional person usually appears as a healthy individual to the community, but actually within them there is this so-called emotional problem that they had. So it is very important. Sometimes for a lot of people, as we said, they doesn't show their emotion well, so we don't know that they are actually experiencing quite a bit of inner turmoil within themselves. So it's very important to take note because there are people like we call it smiling depression. There are people who is actually trying to deny that they're experiencing something that is not good. So we don't actually, if we are not really very sensitive to that, we may miss it and it may go on for a long while and it does affect the person seriously. And by then it's very difficult to undo the problem that they have. So here we talk about mental health versus emotional health. Obviously, mental health involves the processing of information. That means the way you see the information, the way you think about the information. And then once you decided what it is with you, you keep it in your storage memory store, and then to try to understand and comprehend this information. While in emotional health involves the ability to control and express your emotion appropriately. So something, one is about the thinking, emotion is about the expression of your feelings and emotion. So involved in cognitive process. So mental health talks about thinking, again, cognitive process, while emotional health talks about feelings and emotion. So mental health is very wide scope and emotional health is a very limited scope. So there's two different things. But as I believe, if we don't want to get into person's stigma and taboo, I would use all under what we call psychological health, because psychological health means it's about the mind, and the mind talk about the thinking, the emotions or the feeling and the action. So from now on, I think psychological health would be a better term to actually change the past terms where we use mental health. So it is normal to feel fearful. If you say that you are worried, it's normal because people do have these ups and downs in their worriness and whatnot. So the most important thing is when you express yourself, you're worried. So it's good to talk about your feeling because that will actually open up. And this is what we call you start to open up and ventilate your emotion, your worry and whatnot. Yeah? So there are a lot of situations where currently in COVID, a lot of people are worried about, example, financial situation, example, the education problem that they are facing, example, the productivity from organization or company. So there are many things that they are worried about. And some of us go around with the thinking that, okay, their work might not be anymore there permanently if things goes on for a long while. The company might not have any income, and so the company have to lay them down, or not they are able to continue with work. So this has happened. So there's a lot of things that people are worried about or apprehensive about. Or again, the concept of sadness and depression. Always remember, sadness is normal. Sadness is actually your expression of feelings, and that is being shown in your emotion, a mood which is all of us experience from time to time, usually because of the distressing circumstances that we are in. It can become severe, and depression as an illness will only come if it is become more and more severe and is getting more and more prolonged. So this is very important for us to take note because a lot of people use the word depression interchangeably with sadness, and that is not actually appropriate. So here we talk about the sadness or depression versus clinical depression. So for us, the clinical psychologists, the psychiatrists, psychiatrist, the medical doctor, we look into clinical depression, which has a specific criteria. In clinical depression, we talk about persistent low mood, we talk about lack of energy, lack of interest, and hedonia in that sense. We notice that it's every day for at least 2 weeks duration. The time frame is very important, and it significantly disturb their behavior, their functioning, and it disturb their routine. So we look into the level of functioning, personal, social, and occupational, or students, vocational, and whatnot. While depression is actually a normal reaction, it is shown by a certain individual towards a negative life event. So if you know sadness, you don't need any medical intervention actually, but maybe you can do what we call counseling session. We can do just ventilations for people to listen to us and people to actually understand how we are experiencing those issues. While if it is clinical depression, obviously you have to go beyond that. We have to do give medication, we got pharmacotherapy, we got psychotherapy, and sometimes if depression or clinical depression is serious, in the sense of suicidal, in the sense of hurting self and whatnot, we have to give electroconvulsive therapy. So these are the terminology, very important that we need to take note. And depression, obviously, as I said, some is a state, some is already become severe. So if you can sadness, it could be a state temporary, then it leads to further problem of frustration. Then it can become out of frustration, it become irritable, it become angry, and with a sense of worthlessness, you lose interest in your daily activity. This is very important key to suggest that it's already gone into an illness kind of situation. You have suicidal thought that it disturb your biological functioning, sleep, eating, and feeling fatigue and tiredness. While in anxiety, obviously, it is more of autonomic nervous system reaction. We call it sympathetic nervous reaction, sympathetic nervous system. So that's where you got fight or flight kind of a preparedness. Either you want to fight, so obviously every your blood will flow into the muscles, and so you are ever ready. Either you want to fight, or you want to run away, or you want to fly. So there's a lot of things that happen physiologically. You can get trembling, your heart rate increase, your breathing rate increase, hyperventilation, tachycardia they call it. You feel that if it is very high level of anxiety, you can have what we call panic attack. All right, and that you feel powerless, you are sweating, things of that nature. These are the features of anxiety. So if you put them together, that's where you can see when the depression and anxiety overlap, you become more and more restless, you cannot think well, you cannot focus, you cannot make decision, you become over worries, exaggerated, depressed, and things of that nature. It become more and more serious. And agitation can happen usually for a more older person. We call it agitated depression. Usually it happens in the elderly. When they are depressed, they show by behavior. Similarly, for youngsters or for children or adolescents, when they are depressed, usually they show through their behavior. They can become irritable and they become agitated. So these are the features that we need to understand. This will make us subsequently able to know what is going on, especially for the facilitator. They should be able to realize what is going on with the person that they are observing. So to cope during this pandemic, obviously, we always hear that there are many ways of coping. I think most important is first and foremost, can we make our thinking a positive one? A lot of time when our thinking is exaggerated, our thinking, I do send to quite a number of my friends about when we think that everything is going to go worse, that is called catastrophizing. We tend to actually exaggerate the effect of what we are facing. Then we feel that we are becoming doomed. That is what we call overthinking that comes in and make it as though that there's no way out. So thinking is very important. And usually when we face with any kind of a stress, it is all depend on how we look at it, how we think about it, because thinking then will create the emotion or the feelings, and then it also will create the behavior or the action. And secondly, I would say I would go for the installation of hope, which is very important. We must be hopeful of what the situation we are in, and never ever give up, never ever think that there is no way out. Because if you know the wheel of your life is always turning, if your wheel of life is actually stagnation, then you will stay in that position. Unfortunately, not able to change the situation. So there are many other things that you can do, example, exercises, meditation, relaxation techniques. Yeah? Yeah, you can also go out and do activity, indoor game, outdoor game, all right? Or you within yourself, you can do creative activity, you can go for music, you can do some kind of reading. But most important, all this will depend on how you perceive the stress. If you perceive the stimulus as something that is beyond your control, you will not able to actually do these things. But if you perceive that whatever the stress or the stimuli is still within your control, you are still able to look for all these avenues to actually help you out from getting anxiety, depression, or psychosomatic problem. Right. So how to control your emotions? Here are the several ways of doing it. First and foremost, when you are actually feeling a negative emotion, take a deep breath. I think this is very important. How should I say, redirect your body with the blood flow, with oxygenation kind of a thing, by actually having a very good breathing kind of a techniques. Yeah? Taking a deep breath means uh, slow, easy, diaphragmatic breathing, where the exchanges of the gas from the absorption of oxygen and the release of carbon dioxide will be better and at the basis of the lung. So when you have a slow, deep breathing, diaphragmatic breathing, obviously the breathing will be deep inside to the basis. Or actually, you can try to recognize what you can control and what you can't control, because this is very important. So whatever that you can control, you must not lose that control. So you have to tweak your mindset, because what happened is the way you perceive things, and your perceived thing is based on what you believe. So when you believe that things is out of hand, it appears to be very true, but you have to tweak that kind of a negative mindset. So you go for actually, maybe you can write down your feeling, you be aware of your needs, you get plenty of rest, you go for activity, you eat healthy, and you sleep well. Actually, that is another important thing. And they say that you have to get out. There's no way in this situation whereby you still stuck in your house. You must go out to get the vitamin D. You must go out to actually get the sunlight and things of that nature to make your body, to have your body recuperate. So if you want to continue thrive, so these are the things that you have to do and ensure that to thrive means to continuously put an effort so that it doesn't even stop. This is what we call, once you start doing it, you must discipline doing it. You must continuously doing it. So one of it is the positive growth mindset that will boost your super thoughts, boost yourself with your super thoughts. Or actually, you can also have what we call eat super food, high nutrition, whole food. I think later maybe our Felicia and Francis will talk about this, and also the exercise part of it, right? And to me, most important also is enough sleep, adequate sleep, refreshing sleep, and a restful sleep. So this is very important. A healthy sleep practices. Then you also look at other things that you can do. Example, unleash your strength and increase your physical activity. You cannot stay, idle at home or within the situation that you are in. All right, you must actually try to practice stress management. One of it is mindfulness, and then you must get out of the toxic environment. So refresh yourself with proper surrounding. Don't get, I think one of the reason for COVID or this so-called pandemic is when you get stuck in your house and you feel lonely, and you cannot actually move out because somehow you don't want to move out. That is the issue here. So you do some activity, you try to also go around helping other people. Once you help people, you feel good yourself. So I think enlist yourself to community work, social support and whatnot. So these are the ways to continue thriving for these new norms that we are facing right now. So here I want you to have a look just at this situation whereby you can always control what you can control. So things that you can't control, obviously, they will not be easy for you to try to control. So look for what you can control. So focus on that. One of it is your attitude. So another thing is you can actually follow strictly the guideline was given in terms of the SOPs. SOPs, what we are doing is actually the first barrier of our immunity or our immune system first barrier, they call it. For body, usually it's the skin. For body, it's actually usually the ciliars in your respiratory nostril system and whatnot, or in your gut. These are the first barrier. So actually, the first barrier that being suggested by as our so-called health ministry is about physical distancing, about you using the so-called face mask, or using so-called the other method of hand washing. These are all barrier number one that we need to before the virus attack us. If once the virus attack us, then we have to try and see whether we have all this innate immune system that could actually help us out. And then we are waiting for the barrier 3 or the so-called the phase 3 of our immune system is where we got the vaccine. So hopefully the vaccine is not coming yet, but we can strengthen ourselves by barrier number 1. And if ever we get in contact, we hope that our body is able to manipulate and deal with the problem. So what you can control, you must do as much as you can. One of it is you don't listen to all the so-called news that is not good for you. Maybe you only very selected what kind of a news that you want, or you can limit your social media kind of exposure. All right, you can practice kindness and grace and gratitude, and you can give it to other people too, and finding fun to do. Most important is always have that element of happiness and looking at things in a positive manner. That is to look for fun thing that you can do even at home or even with people outside. There are situations where obviously you cannot control, but you were quite disappointed with it. Example like how people did not follow the SOPs, the action of other people that you think will actually disturb and destroy what people you all want to do, but these people are against it. These are the saboteurs. So it's not easy to change people. And so you cannot predict what will happen. Like you cannot see how the people's motive. So you don't even need to look into all those things. You just look after yourself, and each and every one of us, if we can look into ourselves well, I think that is where we can fight against this battle, and we can come out, winning this battle very well, right? Like thinking about how long it will last, and to worry about panic buying. These are all things that you can't do anything much actually. So don't dwell into it and waste your time there. So that is the last slide. So I would actually stop the sharing now and let us discuss with regard to this topic of managing your emotions. All right, Felicia, back to
Right.
you.
Thank you so much, Prof, for your sharing. I think it's really good that you made a definition between emotions and feelings, and what you can control and what you cannot control, and trying to focus on the things. First, it's good to always self-reflect on ourselves before we make or how we respond to the situation, right? So can I maybe that like some of the questions recently sometimes we hear stories about how people get into uh symptoms of definitely stress during the sometimes it could be just like I think it's accumulative of all these different things like work uh and also uh perhaps like the stress and everything. So I'm guessing it also affects our physical self. Like we get like panic attacks or that sense of overwhelm, right? How would you suggest and then if the doctor suggested usually switch it off and perhaps sleep on, like go and rest and sleep and try not to think too much about it, but it's easier said than being done, right? So in your opinion, how should one do it? Maybe because if you go see a doctor, the doctor will basically parrot what they know, right? But again, it's also, like I said, it's easier said than done. So how
Mm,
would you approach it in a way that how would you advise
mm,
um
mm.
the general public out there, like if they are facing with this situation, it really start to affect them physically, like I'm getting
Yeah.
a headache or migraine or I feel overwhelmed, um
Mm,
and probably
okay.
it's felt with bodily function, so it already
Yeah.
affects your daily routine. So what would you advise?
Okay. First and foremost, I just want you all to understand that when we feel stress and when the stress becomes so overwhelmed, the first feature that we have is psychosomatic features. That means the headache, the gastric pain, the body, aches and pain. This is this first signal that we are not actually at peace with ourselves and not in harmony with our psychology and our mind, kind of a thing. So that is what we call the psychosomatic. And usually people come forward for help based on this problem. So what the doctor usually think or trying to do is give a symptomatic relief to that. So yes, actually you can, for acute situation, you can try to work on the symptomatic relief. As I said, these are the accessories of managing the problem. But the real thing is, if you want to deal with your problem, you must know who you are, how your belief about things, how your perceptions about things, what is actually in your mind that make you feel that way. Example, what make you feel that you cannot get on top of this stress or stimulus that cause you to have the stress. So as you said right now, people feel that they're already losing the battle. Yeah, true. You think that you're losing the battle. Example, like if you don't have enough money, you say that's it, it's going to be doom for me. And then now you know that okay, I don't have enough strength within me, it's going to be doom for me. So that is the issue. You must realize that you have that weakness. You must realize the way you believe it, the way you perceive it, the way you actually uh, uh, feel that you are losing, and that is when a lot of time people are trying or people can help you. That's why for financial situation, government is helping out in terms of moratorium for paying the debts. Some country need to pay the house rent, allow them to stay in, encourage the the people who actually the bank and whatnot not to ask the money from people who have suffered. So these are the ways that they are trying to minimize. But for yourself, I think this is where you must be able to have a very strong way. Example, one of it is the ability to come forward and negotiate how to work on the issues that you have. A lot of time people don't know how to negotiate. Example, financially, with the bank, with the people that they have trouble. Example, also if let's say they think that they are already in the worst situation, they don't see anyone who can help. But actually, there are many people who can appreciate their problem and who wants to help. So that's why you have to move forward, look for that kind of assistance. So temporarily, obviously, you can give whatever that you can, but this again will end up later. You have to strengthen yourself within. So from now on, expect the unexpected. Be prepared. Preparedness is very important. Never think that things or life doesn't go this way. It will always be there. There was always some challenges that come up. So we have to be ever ready to face the challenges. So unfortunately, for some of us, maybe all this while, we never have this what we call survival nature or instinct within us. And because we don't have this survival instinct, we are not prepared to survive. I think that is our problem mainly. Most of us, youngsters, even us, the elders, We never prepared to survive situation of this nature. And that's why when it come, we feel so lost and we feel so, we lost the battle in that sense. So I hope come forward, get help, talk to someone, because no way you can deal all this problem alone, right? This is what we call, I think COVID has teach us one thing, that is togetherness. We can prevail. We need support from each other. So that is, I think, the message that COVID is trying to tell us over this one. No more country is supposed to be just, example, like people are talking, Europe, America having all this so-called extras of the vaccine. So they should actually pass on some of the vaccine to the poor country. So I think that is a big issue now, because some places they bought a lot of extras, and their population is actually already beyond the number that they can use. So if they can buy a lot, they have to share with other people. So this is where the calling is, where people are actually very concerned and care and compassionate. I think this is what COVID is trying to tell us.
Right. Yeah, I think leaning on to others for support during this time is important, as well as embracing and take it one step at a time. I think one of the things that you mentioned, I think a few on your last two slides, it's about how you can focus on the things that you can control and take it one step at a time. Work on exercise, work on nutrition, work on, not exactly just by thinking positive it will go away.
Mm-mm.
But recently, there was a gratitude expert, that was sharing her tips on how she would start her ending her day, and how she starts her day by setting in the right intentions. Like today's going to be a good day. I'm going to be energetic. I'm going to help other people, like depending on the work that you're doing, right? Like
Yeah.
let's say you're doing coaching, right? Or you are a lecturer and things like that. So that it helps even as challenges comes in front of you, like if you see the how many new positive cases or whatever news that may come and shock you, you will be more uh, not so affected by it, because you already set yourself to take on those challenges. And having those gratitude at the end of the day,
Mm.
regardless if it's the smallest thing that is positive in your day, I think that is also very important as well. So um,
I think if you want to know about war, about situation of this nature, quite a number of people who are actually able to withstand the stresses and the distresses in the war is when they don't think about themselves anymore. They think about others first. They care to actually give to others first what they can, and then so they are not worried about themselves. So sometimes turning inward, looking at self and things of that nature, that is where we get stuck and we get into trouble.
mm,
We can think about doing for others, we get back whatever that we give. You'll be surprised. It will come naturally. We give
yep.
to others, and others give to us also.
Yep.
That is different.
Sometimes, yep. Sometimes it's just to look around what you can do for the neighborhood, for other people, right? Yeah. And that's how you feel better. That's why always volunteerism and also helping other people or community work has always been a part of sometimes you think, yeah, it's not so much about helping other people, or that person getting help, but in return you receive a lot more as well.
Yeah,
Yeah.
yeah. Because you have to give before you can get. So I think that is important. So if you don't focus on yourself, then you don't feel bad about what you don't have.
Right. Right. Yep. Are there any questions, maybe from the floor that you would like to? Yeah, you can unmute yourself,
Shakir, yes,
Dr.
Shakir.
Shakir. Yep. You still have to unmute. You have to.
Unmute Shakir. Mike.
Okay. Oh, can't hear you still. Is your audio plugged in? You're unmuted already, but is your microphone on? No, I can see your lips moving, but we can't hear anything. So your audio mic jack has to be inserted in the right one. Speak. Sometimes it's on the. Okay, Prof. You're also muted. Wait, let me
Now, do
see.
you hear me?
Yes, Dr. Shaker.
Do you
Yes,
hear me?
yes.
Oh, okay, okay.
Now we can hear you. Great.
Okay, so actually, during the COVID situation, in our mental health aspects, we heard a lot of about anxiety disorders, depression, and then stress-related condition. So I want to add two more important disease, especially in our psychological aspects. Actually, we see a lot, but we do not say much about these two things. So I want to mention two disease, important disease. One is OCD and another is illness anxiety disorder. So we see a lot of patients actually during this COVID situation. Those who have OCD traits, they during the COVID situation. So we know during the SOP, a lot of things we thought wash our hands frequently, and then if you want to go outside or in shopping, then whenever you come back, you have to wash your clothes, everything. So those who have the traits, actually, we see a lot of patients actually develop the OCD symptoms, even the OCD itself. And another important thing that illness anxiety disorder, as you know, uh, in this pandemic, actually, in our community, a lot of people has been suffering from flu-like illness. So those who are suffering from flu-like illness, they think that they maybe perhaps they infected with COVID. uh, so in that issue, they sometimes this may be turned into the illness anxiety disorder. That is one psychiatric aspects, important psychiatric diseases. Even some people they develop psychotic symptoms also. It's very dangerous. So these things are very important. So I want to ask Prof. Mohammad, do you agree with me this in these issues? And
Okay. All right.
give you please give your some important opinion regarding this aspect.
Okay, sure.
That's a good
Okay.
point, Prof. Yeah.
Yeah. Actually, to start with, most important is that, as I said, all of us possibly has vulnerability traits that could lead us to some kind of a state, or at the end of the day, become unwell or disordered or illness. So, in this so-called chronic stress with COVID pandemic and whatnot, so the real fear of getting infection is always there. So unfortunately, for those who have trouble with their so-called personality traits, that is bad or weak, which make them easily to get into this situation. So it can come out to become not only just a trait, now it's become a real issue. It become more and more prolonged. So that's how OCDs may come forward. But for those who actually that's why when we say somebody need a pushing factor, we call it a precipitating factor to make them come out with the condition. So, example, when we're trying to understand a mental illness, we need to understand three P's. Three P's, we call it whether that person is predisposed, that means genetically he's unwell, whereby the family has the problem, so he may have it later. So that is called predisposing factor. The second is precipitating factor, which is actually the one that push him or her to have the illness become more prominent. So the one that push them down to a breakdown situation. Then along the way, some of these kids or some of these person have what we call perpetuating issues. All this while their life will never actually appear to be happy, to having a lot of issues that they're having. So it is an ongoing problem. So if we can understand, so now COVID pandemic could be the very serious precipitating factor that make somebody turn psychotic, make somebody become serious in their anxiety or depression, and make somebody end up with a lot of other psychiatric problems. But what we are seeing in a normal, strong person who doesn't have that tendency, this is what we are saying. Usually the fear become clear until unless the stimulus is no more there. So it is not an anxiety, but it is a fear towards it. That's why we are worried. Some of us are so worried about, going in the crowd, and then when we hear that somebody in the crowd is possibly coughing, and then they go back with actually that so-called suggestibility, they also start to feel feverish and they start to cough, and then they become worried about that. These are all because of the within themselves. It's rather way of interpretation, way in terms of belief, and one of the reason is actually misunderstanding, misinterpretation, or poor education about how this thing is going on, COVID, coronavirus kind of a thing. So I think these are there is a complex situation. It's a combination of many situations. So yeah, I can say that those who are already existing psychiatric problem, it can even get worse. I can say that a lot of psychosis person who get stuck at home become more and more psychotic. Those who are actually obsessive compulsive, those who are actually depressive person already get stuck in the situation, it's become worse. Things of that nature. So admission to HBUK is actually increasing because of this situation.
Yeah, I think you have a good point there, Prof. I think it's important to get diagnosed and treated. I think just during the pandemic, everything is being magnified. And it's also very important to be on the platform. Like, for example, this platform, I think earlier on we had, if we stay close to what the Ministry of Health is saying, how to, because we are all obviously living in fear from the beginning because we don't know what's happening, right? Like false evidence appearing real. Like even when we get like we start to sneeze or we are not feeling so well, feverish, we immediately think about the worst thing. So being on the platform, getting the right information, the three C's, close contacts, confined spaces, and crowded places, and wash your hands regularly. So those are things will help. Maybe that doesn't have that issue, but of course, because we are having fear, so we can take it one step at a time. But if you are somebody who's experiencing, I think, long-term effects of it, it is actually important to seek help rather than keeping quiet. I think that's the key. We do have thank you, Dr. Shaki, for the question.
Another
We do
question.
have questions.
So,
We do have two questions from the floor. Okay, let me get to that first. Yeah.
okay.
So number one, how do you avoid yourself from overthinking, and how do you know actually you're overthinking?
Okay. Once you are overthinking, actually you end up become paralyzed. That's when you know, okay, overthinking is too much already, because you cannot move, you cannot even think, you cannot do anything. That is where overthinking lead to actually paralysis of your mind. So now you are very stuck, and as people say that once you start into overthinking, you are in the cycle. We call it the vicious cycle, like you're in the washing machine, keep turning and turning, and the thing you can never stop it. The way that what you think about is going to be more and more thickened, more and more problematic, and you still hold on to that themes or that problem seriously for hours and hours. That is where even until sleep time, it is still there. That shows that you're overthinking. The so-called non-overthinking person is like this. It come very fleeting. It just come in, then you just brush it away, then it doesn't come in back in. But remember, if it comes back again, that means you're not overthinking yet, but you're allowing it to preoccupy your mind. So it started with that. It started with an idea, and unfortunately, when the idea stays, it becomes preoccupation. When the preoccupation become worse, it becomes obsession in your thoughts. And when obsession become real obsession, and that's when you start to actually add on with overthinking about the effect, what caused it. So it become more and more in the very situation of you're lost into it. That's when the problem is. So the key is very important. If it actually occupies all your time, 24 hours, 48 hours, is the same thing, affect your sleep, affect your mood, affect your happiness and whatnot. That means with only this one particular theme, one particular issue, that means you are overthinking about it.
So how do you avoid or how do you move yourself from
Okay.
that situation? Yeah.
Number one is you learn how to use stop stopping. Right? Never at least allow it to move to the next so-called the next level, even the very from one it begins, they call it the seed of it. Never allow the seed to grow. So that means once you know that your thought is bad thoughts, your thought is something that thought is something that is going to be affecting you, put a stop to that thoughts. And that's why we teach you to do, in terms of this, we teach you how to do cognitive restructuring, cognitive reorientation, cognitive, then you do the new thinking about it. Immediately, if you say that it's going to hurt you, then if we want to counter it, you must look at, okay, how does it hurt me? You actually trying to use rationalization. You're trying to use intellectualization. You're trying to look for why I actually think about it that way. So it is an exercise. That is part and parcel of actually cognitive maneuvers. Cognitive therapy will do that. So that means you have to learn how to put a stop to it. Because if you don't put a stop, if you want to know what is going to happen, if you don't put a stop to that thinking, you look at how does it affect my emotion? How does it affect my reaction? So if you say that, oh, it gives me a very bad feeling, it gives me a, I'm angry, I'm irritable, then you know already you cannot move forward from that first instant that you have that thoughts. So that's why you must know how to actually push aside that thought. And one of the way to push aside that thought is actually to do mindfulness. And mindfulness actually works on your conscious level, and you know at conscious level that that thought is not warranted. So this is where you must start training your conscious thinking about things. So we
Right.
try to teach you how to do mindfulness.
That's good. That's good. I think putting knowing the fact that you are thinking about something and not letting it get to the next level.
Mhm.
And the mind needs to be trained, regardless whether I think you're an expert or a normal person. I think we all need to train our mind every day because there are different challenges every single day, right?
Mm.
Yeah. So I think a lot of misconception. People think that, am I the only one overthinking things? Or I think it happens to everybody. It's just the difference between a trained mind and a trained mind, I feel.
Okay.
Yeah.
All started with
Yeah.
being an amateur, but later if
Mm,
you start doing the training, you will become
mm,
an expert. The
that's
thing is
good.
that
Okay,
if you
Dr.
never
Shekhar,
train, you never, yeah.
great. You have the last question. Yep. We have one more question just in time before we end the session. Yeah.
Yes, another important thing that we have seen during this COVID situation, some people are smoking much, some are drinking much, even some are addicted to some drugs. So it's very important issue. So I am asking Prof. Mohammad regarding that issue, what we can do or what we can overcome this situation.
Okay, first and foremost, always remember this. You cannot do anything for other person unless he wants you to do something for him or herself. Always remember that. You cannot impose, you cannot force somebody who doesn't want to even do things for themselves. You can assist if they ask for your help. So for those who end up with smoking too much, for those who end up even destroying themselves more, until unless they realize that is a bad thing that they are doing, and they really accept that it's a bad thing, and then they say, I want to do something about it. And then the fourth thing they say, please, doctor, can you help me to do something about it? Only then you can actually get into the situation of helping that person. What you can do, at least make them aware that what they are doing is not good. But again, as I said, if they don't want, you can bring 10 experts in front of them saying what is right, what is wrong. It is like, taking a horse to the water, but if the horse doesn't want to drink, you can't do anything much. So it's very important. Quite a number of time we thought we want to do something for someone, but actually that person is actually the one who need to do something for themselves. We can only facilitate, we can only assist. So if we doctors say that, no, don't worry, I will help you to be a different person. But remember this, if the person doesn't want your help, it doesn't work. So I think that is the issue here. All right. So first and foremost, negotiate with that person. Do you know that what you are doing is not good? What you are doing is actually improper? Do you think you need to look into that so that you can be a better person? And if that person starts to answer all yes, is what you want to suggest, it will become easy for you. That is where, when you got a yes, 3 yeses, you can actually hypnotize the person. You can actually, with the NLP, you can also change that person subconsciously with only 3 yeses that you need to know from that person. I mean, that person start to trust you already. Yeah,
Right.
I hope
I think
answer the
hope that,
question, Shakir.
yeah, you cannot, I think I summarized it very well, Prof. You did it like in to summarize it, basically it's you cannot help somebody who doesn't want to help themselves, right? And that is very important. First you have to but as facilitators, or have, if let's say it's a person of that you know, your loved ones or your close contacts, right? I think that's one of the way to be a friend, be somebody who can be in that circle of like knowing that they can come to you if they need anything. And that's very important. I think we all need a safe space to be able to share our feelings and deal with our emotions, right? So that will be very an ideal. I don't think there is any ideal way of like. I think once a person set their mind to get help or and deal with their situation, I think they know who to look for. I think you know, all these conversations are going to help us to be more aware of to be more mindful and aware of our own feelings and emotions, and also to the people around us. I think that's really, really good. So
If I
yes,
may add,
Prof.
Felicia.
Yeah.
Okay, one of the telltale signs to say that the person really actually want to get help is when
Mm,
they have interest in you. When they say something about themselves to you, maybe that is the beginning of a relationship which could end up become a therapeutic relationship. This is important. It doesn't mean you have need to be a doctor to reach a therapeutic relationship. You can even be just a friend who can listen well and show them the way how you perceive and how you would react. So that could be also become therapeutic because, as I said, when the person just start telling you, somehow he already have some confidence to actually open up to you. I think they
mm.
need to take that seriously.
Wow, I think that's really good. So let's be mindful about it. And yeah, who knows? I think we are put on this in this world. I think we even in this conversation, there are you know, 7 to 8 of us to begin with. And we can make that difference by normalizing conversations and hopefully continue this hopefully with more empathy, with more kindness, of course, first to ourselves and of course to the people around us. So again, this is actually a collaboration between the FIT unit and PRKPP to bring you sessions, Ask the Expert sessions, so we can be more well informed in matters of the mind and matters of the heart. You know, I think it's really important to be able to talk this thing. And sometimes we put our conversations online so that we will be able to reach out to more people and create awareness. And of course, we always have our regular expert on the house, Prof. Mohammad. And if you would like to seek further information and would like to reach out, you can always do so. We are all you're able to reach any one of us. And yeah, we hope to see you again on the next Saturday, our evening session, right? And with that, we want to thank all the people who is on the call. Dr. Shakir, there's Nurin, Hani, there's Hannah, and there's Coach Wong. So wherever you are, be safe, stay healthy, follow the SOP, and we will meet soon. Yeah.
Okay, sure.
All right. Good night, everybody.
Good night. Thank you so much
Good
for
night.
listening.
Good
Good
night.
night.
Thank you.
Thank
Have a great
you.
weekend.
Okay.
Stay safe.
Yeah. Likewise.